patient is newly diagnosed with hepatitis B, the nurse is reinforcing discharge teaching. Which instruction should be included? Select all that apply. Let's do this one. Option A, avoid sharing razor and toothbrush. So what kind of precautions we need for hepatitis B? Yeah, the one time was 6 hours. I know, I still remember that one. What kind of precautions we need for hepatitis B? Is it contact precautions? Is it... What kind of precautions we have in hepatitis B, guys? Anyone? Mothball is blood and bodily fluid. Okay, so avoid sharing razor and toothbrush. So if we are definitely sharing the razor and toothbrush, there is a higher chances of like small amount of blood can transmit it to the another person. So definitely A is correct. Okay, what about B, guys? Abstain from alcohol to prevent liver damage. So is alcohol consumption harmful for the body? Is alcohol consumption harmful for the body? Can it cause liver damage? Yes. Okay, especially we already have liver already inflamed, and so it's gonna affect it's definitely gonna affect and make it worse. Sexual partners should be tested and vaccinated. What about C, guys? Good advice, but it's not C. JJ, it can be C. Yes. Yeah, because hepatitis B is sexually transmitted also. So both partners need to be checked and vaccinated and protected. Okay. What about D? Is use standard precaution to prevent airborne transmission. Can it transmit through the air? What about D, guys? Anyone? No. Okay, it can't transmit through the air, so we don't need to worry about that. What about E? Maintain adequate rest and nutrition. Why we need rest and nutrition in this one, in hepatitis B? Yes, because our liver is inflamed too much. Liver need rest to heal. So that's why it's very important to have adequate rest and nutrition. Okay, let's move to question number 12. So the nurse is reviewing medication option for a patient with chronic hepatitis C now. Which drug may be prescribed? So we know hepatitis C is viral liver infection, usually transmit through the blood, like Hep B. It often become chronic. Like patient can have cirrhosis, patient can have liver cancer. Yeah. So it will be combination of the antiviral medications. So which medication we can give? Can we give DAA, direct acting antivirals? Anyone? Which of these options we can give to the patient? Yes. Okay, DAA, it is the standard. Okay, these one are the standard medication or treatment for the hepatitis C, and they do have actually high cure rate, and it is more tolerated in the patients. So definitely A is correct. Interferon therapy. What about B? So because now we have the direct acting antivirals, we don't use interferon therapy that much because there was too many side effects. So that's why we will not use it now, but still it's recommended. Okay, this is still reviewing medication that can be used in the patient. Okay, So what is BJJ? Okay, interference, especially it is the protein, it is the kind of the protein that we have in our body. It helps with antiviral state. um, it can produce lot of other protein. Okay, and it will be ISG, I think so. ISGS. Okay, that will be interference stimulated genes. Yeah, so it will inhibit the protein, viral protein synthesis. It will inhibit the RNA. It will block the viral entry. It will activate the enzyme so viral can't replicate. So a lot of things they will do. Okay, yeah. Usually when any cell attacked by cancer or virus, they produce the interferon in our body automatically, and that will produce the another these ISGs. Okay, and then they will start acting. So if we are giving the interferon therapy, it will produce ISGs, and that will help to reduce the virus in body. Ribavirin. What about C, guys? Ribavirin. So even though like some of us might not know these medications, is still good because this one of the medication is antiviral also. It can give along with other medications. Okay, so this is correct. What about proton pump inhibitor? Is proton pump inhibitor gonna help with hepatitis C? Anyone? We are going so slow, guys. Today we are going no. Actually, proton pump inhibitor not gonna help with hepatitis C because we only need uh, antiviral medications. And what about corticosteroids? Same thing. Corticosteroid, are they helpful in viral infection? No. Okay. Corticosteroid are immunosuppressant. You already having the hepatitis C, and if you are giving the immunosuppressant to the person, then patient's situation is gonna get worse. Okay. They will I don't wanna say that, but they will get on the wrong side of the road. Yeah, so we want immune system to be improved. We don't want to suppress the immune system. Okay, let's move to question number 13. So a patient with cirrhosis is admitted. Which clinical manifestations are expected? Select all that apply. So we know cirrhosis is final stage of chronic liver disease. It can be with lot of scarring of the liver tissues. So okay, can we see jaundice in cirrhosis? Yes to A. Yes, because we know scarred liver cannot process the bilirubin. Okay, so when we can't process the bilirubin, the byproduct of red blood cell is gonna accumulate in the body, and that can cause the jaundice. Okay, so A is correct. Ascites. Is ascites one of the symptom or complication in cirrhosis? Yes. Okay, because why we are having ascites over there? Because there is a portal hypertension now. Yeah, so when we have portal hypertension in cirrhosis, then the fluid gonna leak into the abdominal cavity, and you guys will see ascites. Yes, it is the complication. And what about the petition and bruising? Why we or patient can have petition or bruising with liver disease? Anyone? Yes, RBC. What else can be there? What is the function of liver that can cause bruising? If that Liver is affected, yes, because liver is one of the thing that produce the clotting factor. Okay, so when we don't have enough clotting factor in our body, then there will be more bruising because there is tiny bleeding going on. Okay, so you will see now liver is in cirrhosis stage, there are not enough clotting factors. Okay, so we will see C over there. What about D, guys? Weight loss and muscle wasting. Hi Rugal, can we see? Yes, and again the thing is that liver's main function is to metabolize nutrient. So now liver is cirrhotic, there are a lot of scarring happen over there. It can't metabolize nutrient according to the capacity, and that can lead to the weight loss and muscle wastings. Okay, so you guys can see this one. What about serum albumin level? Is it gonna be low or high? What about high? High. um Actually, we're gonna see E also, liver. This is the one of the reason why you see ascites in cirrhosis. Okay, it will be low. Yes, definitely. You're gonna see low serum albumin level. Okay, albumin is produced by liver. Okay, and when you will have less albumin in the body, the osmolarity of blood is changing, and that's why more fluid will move from the systematic circulation to abdominal cavity, and that's why you will see ascites. And that's why I sometimes I trick it down, like whether you're gonna see low or high. Because it can be normal also. Why we don't think about the third one? So please do the critical thinking, like what can happen. Yes, yeah, that's why we infuse albumin instead of fluid. Okay, because you if otherwise we are just gonna cause the hypervolemia, and that's gonna keep increasing the ascites. You are having portal hypertension anyway. Okay, question number 14. Question everything you answer. Question everything. Why I'm answering this one like this? A patient with cirrhosis is prescribed lactulose to manage hepatic encephalopathy. Which finding indicate the medication is effective? Lactulose. What about this? We know lactulose gonna help us to, because it is a laxative. Yeah, is it gonna help to manage hepatic encephalopathy? ABDE. Okay, let's see. A yes, decrease serum ammonia level. Okay, this is one of the target. Okay, so what happen when we give the lactulase actually trap the ammonia inside the GI tract and then excrete it through the stool. Okay, so definitely decrease serum ammonia level. When we have hepatic encephalopathy, there will be and decline in the brain function, and liver can't remove toxins on that level, especially ammonia from the blood. So this is definitely gonna trap it down in GI tract and doesn't let it absorb. Yeah, yes, ammonia cross the blood brain barrier to cause mental issue. Thank you, yeah, definitely. Improve mental status? Yes, because now we having less ammonia into the blood, and that's why we can see improved mental status. What about C? Increase bowel movements. Is it the normal function of lactulose? Yes. Okay, this is one of the function of lactulose, so we're gonna see that one too. What about normalized liver enzyme? You have patient with cirrhosis. Are you gonna see normalized liver enzyme? No, okay, this one is chronic, so we will see elevated, okay, and definitely if we will stay within the question, lactulose doesn't affect the liver enzyme, okay, so it's not gonna cause normalization. What about E, decrease ascites? Does lactulose work on ascites? Is it gonna affect the body fluid? No, okay. Again, it is not a diuretic. It's not gonna directly affect the body fluid and not gonna help with ascites. Okay, so 14 is wrong. Let's move to question number 15. So the nurse is caring for a patient with cirrhosis and ascites. Yeah, it's mainly to pneumonia, definitely. Which interventions are appropriate? Select all that apply. So now we have ascites is a complication, like we really don't want to see that one. Ascites is accumulation of fluid, depend like how much it happened over there. It can happen to the portal hypertension, low albumin, you know, and it can affect the respiration also. So sodium intake, what about sodium? Restrict sodium intake. Yes, because there is already fluid overload. If we will give the sodium, it's gonna retain the fluid and it's gonna increase the ascites. Okay, so we will restrict the sodium intake. What about B, guys? Administer diuretic as prescribed. And most of the time we discuss like, okay, in NCLEX these are the keywords like as prescribed. This is not wrong, this is not gonna be wrong. Okay, so diuretic we know they excrete the fluid from the body, so they are definitely gonna be helpful. Yeah. What about C, measure abdominal girth daily? Can we see by this? Yes. Okay, C is yes, because then we can assess the situation like how much fluid retention is there, and it can give us like non-invasive way. It is very effective, so please do that one. C is yes. What about D, place the patient on strict bed rest? D is yes. Okay, this is the thing. Okay, this is the another keyword I will highlight. And is it strict? Bed rest is important. Okay, bed rest is important to heal the liver, to decrease the metabolic demands, but strict bed rest is not relevant over there. Okay, yeah, so if somebody is on strict bed rest, it can increase the chances of like blood clot, so that's why we don't want to do that. What about E, guys? Monitor for respiratory distress. We just discussed like accumulation of the fluid into the abdominal cavity can put pressure on the diaphragm, and if there is too much pressure on the diaphragm, it can reduce the respiration and by making patient difficult to breathe. Yeah, so we're gonna monitor that one definitely. Oh my god, what I did. Yeah, thank you guys for following. Please make sure you guys also subscribe Nursingy on YouTube, because all of our previous lives are getting uploaded over there. Okay, so if you have missed any of our live, it will be uploaded on Nursingy at YouTube. So just search this one and subscribe, please. Question number 16. So a patient with cirrhosis develop esophageal varices. Which nursing intervention should the nurse anticipate? Okay, guys, let's do. We have done that before, the same kind of question. So we should have all the options correct, especially the one who gave the last question's answer. Okay, administer beta blocker to reduce portal pressure. Is A gonna be helpful? Yes, if we are giving the beta blockers, we are reducing the hypertension. There is less stress on the arterial or venous wall, and there is less chances of bleeding out. Everyone happy with A? Yes. reduce workload? Yeah. Okay, it will help to reducing the portal pressure also. Okay, what about B? Prepare for possible endoscopic band ligation. And this is the another thing, like most in the we discussed from yesterday also. Preparing is good. Okay, preparing is good as long as it's relevant to the treatment. Yes. Okay, so this is possible. Yeah, because this one is the definitive treatment to stop the bleeding from the varices. So that's why it's important, it can happen. What about C? Insert a nasogastric tube for gastric lavage. What about C, guys? What's gonna happen if we're gonna try to do C? Rest the throat? No. JJ, what the thing is that here, because if you are inserting the nasogastric tube, it can cause the varicose tear already, so it should be avoided. Okay. Yes, Juni, we're gonna see bleeding. Okay, so make sure we don't do that. Um, Administer IV fluid and blood product if bleeding. D. More bleeding, yes. Okay, D is correct, because if there is a bleeding going on, there is very high chances of hypovolemic shock, and to prevent the hypovolemic shock, we want to make sure like we are administrating enough IV fluid and blood product. E. Teach the patient to avoid straining and heavy lifting. What about E, guys? Yes, Nelly. Teach the patient to avoid straining or heavy lifting? Yes, because it can increase the abdominal pressure and that can trigger a varicose bleed. Okay, so that's why we will definitely teach them not to do that one. Okay, question number 17. I think we are doing so good today, so we can keep going as long as we can. Okay, a patient is admitted with acute pancreatitis and severe epigastric pain. Which intervention should the nurse anticipate? So we have acute pancreatitis now. It's sudden inflammation of pancreas. We discussed about it yesterday. You know. So why we can have pancreatitis? It can be due to gallstone. It can be due to too much alcohol use. So now pancreatic enzyme is digesting pancreas. Yeah, keep the patient nothing by mouth, nil by mouth, NPO. Yeah. What about A, guys? Yes. Is it priority? Yeah. Because like a patient will start eating, then they're gonna produce the digestive enzyme. So if they are on the rest, okay, if they are not eating on restricted fluid, nil by mouth, then definitely there will be less enzyme. So it's good, it will give us time. Administer IV opioid for pain, can we give that? How is opioid? Yes, because acute pancreatitis pain is too severe. Sometimes it's most of the time it's 10 out of 10. Okay, so IV opioids definitely gonna help. What about C? Insert nasogastric tube for gastric decompression if vomiting. Is C correct? Yes. Okay. C is definitely correct because it's gonna reduce the pressure on stomach, and especially when patient is having the acute pancreatitis, there will be loss of nausea and vomiting, and if patient we are having NZ tube, that's gonna help us to reduce those complications. Okay. Encourage early oral feeding to promote healing. What about D, guys? No, we just talk about to keep patient nil by mouth, so we don't want to encourage to oral feeding. That's gonna increase. Okay, that's gonna increase the side effect. We will encourage once patient is like settle down after the nil by mouth, then we'll slowly introduce. Okay, once pain is done, pain is subsidized, then we will do that. Okay, monitor serum amylase and lipase levels. So these are the two enzymes that actually produced by the liver, serum amylase and lipase, and they can actually cause the complications, a lot of complications. So we need to monitor whether how disease is progressing. Okay, thank you everyone who just went to Nursingy at YouTube and subscribe. Really appreciate. We are gonna post these live over there. You guys can already see all of our old live on YouTube. So please make sure you guys search Nursingy on YouTube and you subscribe. Okay, just monitor airway as well. Yeah. Okay, let's do question number 18. The nurse review lab result for a patient with acute pancreatitis. Which abdominal finding are expected? So now we know we are having pancreatitis and we know it's releasing or not releasing enough digestive enzyme. But most of the time when you have acute pancreatitis, there is high production of digestive enzyme. Okay, because those digestive enzyme now those digestive enzyme are now eating that pancreatic tissues. So that's why we have more concern. Thank you, Celia. Please make sure you subscribe YouTube also. If you are new here, you can watch our old live over there also. Okay, we post these video over there, so make sure you subscribe. Okay, elevated amylase lipase, yes. Okay, this is what we were talking about. Elevated amylase and lipase, these are the diagnostic markers. What about elevated blood glucose? What about B, guys? What about B? Yes. Okay, even though when amylase and lipase increase, the production of insulin decrease. Okay, so when we don't have enough production of, because it's pancreatitis, it is affecting the symptoms of production of those hormone. Pancreas now can't work properly, insulin is not properly producing from pancreas. So that's why we will see hyperglycemia. What about hypocalcemia? Are we gonna see hypocalcemia? Yes, yes. Because it can combine with fatty acid released. Yeah, yes, fat. Definitely. Fat saponification. So you will see hypocalcemia is the main one. What about D? Elevated bilirubin. D, no, no. Okay, because elevated bilirubin we can see in the gallstone cases, like if there is a gallstone, but because that gallstone is not indicated into our question, like a patient is here with, why that patient develop acute pancreatitis, so that's why we don't want. Celia, which one? Which one you want me to explain? So that's why we don't want to work on elevated bilirubin. Yeah. Yeah, it is, Ashlyn, definitely. It is one of the cause of acute pancreatitis is gallstone. Okay, when bile duct is actually, so that's why, because but the thing is that if it is there in question, then we will see. If there is nothing in the question, that's why we don't wanna work on that one, because it is not always the case. So if they are saying here gallstone, then definitely we will have elevated bilirubin most of the cases. Yeah. Hypocalcemia, why? I think somebody already told hypocalcemia in pancreatitis. Why we have that one? Anyone? We talk about fat saponification. Yes. Yeah, because what happened? Yeah. So everyone aware about fat necrosis. So when is like that is the main cause in pancreatitis. So when we have pancreatitis, digestive enzyme, especially lipase in this one. So lipase is the one that will cause the fat necrosis, death of the fat cell. Okay, when those free fatty acid release from the dead fatty cell, they combine with the calcium. Okay, and that process we call sponification. Yeah, and they will make the calcium soap, and now too much calcium is bind with that fatty acids, so that's why you will have less available calcium in the blood. That will cause hypocalcemia. Is that okay? Hopefully I try to make it as easy as possible. Yeah. Okay, so this is because lipase destroy the fatty acids, and then calcium join that fatty acids, and then sponification, less availability of free calcium in the blood. Yeah, so it's depend how much lipase is working, and in pancreatitis there is lot of availability of lipase. Elevated hemoglobin and hemocrit, are we gonna see this one? Is this primary indication? Yes, so less serum calcium in circulation. Definitely, Nico. Yes, that is the reason. That is the reason. Yes, elevated. Actually, no. We usually have elevated hemoglobin and hematocrit value in dehydration when there is hypovolemia, there is too much red blood cells and destruction of those cells. Okay, we don't. It's not the primary sign over here, so we can skip this one. Okay, we usually need to see the signs of infection only. There is nothing related to hypovolemia is going on. Alrighty, let's move to question number 19. We might well do another 10 question. Please go to Nursingy at YouTube and subscribe, guys. Thank you for the 5 people who just went over there. A patient recovering from acute pancreatitis is preparing for discharge. Which lifestyle modification should be included in teaching? Come on, guys. Question number 19. We know why we need lifestyle modification, because there can be reoccurrence of pancreatitis. Thank you, Pama. So A, avoid alcohol completely. Yes, okay, because alcohol and gallstone is the major trigger of pancreatitis. Okay, so we wanna avoid the alcohol. Eat a low fat diet. What about B? Is it correct? B, yes. What about B, guys? Yes. Okay, B is yes, because like if you will eat high fat diet, then body will produce more lipase, and lipase can digest the pancreas itself. Okay, we don't want more production of lipase enzyme, so we will have low fat diet. What about C? Maintain hydration. Is staying hydration preferable? It's always helpful. Yeah, and when it say maintain, that's the keyword. They don't increase, they don't decrease, so maintain is always good. Okay, what about D? Resume smoking to help reduce stress. Is smoking gonna help with stress? No, it is especially again one of the risk factor. Okay, and what about E? Report symptom of abdominal pain promptly. Yes, because if somebody is having abdominal pain, that is gonna be the indication like patient is again gonna have the pancreatitis. Okay, flare up. So we need to make sure like we are teaching or educating patient about that, and they need to report it as soon as possible. 20. So a patient with suspected cholecystitis present to the ED. Which assessment finding are expected? Select all that apply. So cholecystitis, what it is, guys? Inflammation of gallbladder. Everyone happy with that? Most of the time we have gallstone over there. Yes, yeah. Okay, right upper quadrant pain radiating to the shoulder. Isn't it the most classical symptom? Yes. Okay, so this one is the most classical symptoms of cholecystitis. Okay, what about B, nausea and vomiting? Can we have that one? Because now we have gallstone and they affect the bile, they affect the um, digestion, everything. Yes, nausea, vomiting. What about positive Murphy sign? So same thing here also, we are palpating the right upper quadrant. Okay, and patient is having the pain. So positive Murphy sign is key indicator of cholecystitis. Alrighty. So this need to be positive. Diagnostic sign, physical one. What about D, clay colored stool? What about D, guys? Anyone with D? No, no. Okay. This is not sign of cholecystitis. This is sign of when we have complete obstruction of bile duct. Okay, then we can have clay colored stool, not with cholecystitis. Hematemesis, vomiting blood. Does gallstone have any relationship with upper GI bleeding? No. Okay, so this is sign of upper GI bleeding. So we are not gonna see hematemesis in that patient. Okay, guys, we have done another 10